All right, well, hello everyone. Thank you for joining us for today's conversation, which is a part of a series of Path Life forums. My name is Caitlin Jolie. I'm the Global Events Manager at Path, and I'm just going to share a few logistics before we begin. Today's conversation is called 2020 and Beyond, a Zoomside chat with Path CEO Nikolaj Gilbert and Path's former CEO and recent author of the book Undercurrents, Steve Davis. We want to hear from you during this conversation, so please share your questions and comments with our speakers by submitting them in the chat or Q&A box at any time throughout the discussion. Steve and Nikolaj will answer your questions in the latter half of the hour. And this call is being recorded and will be available on path.org for anyone who wishes to watch. And with that, we will go ahead and jump into the discussion. Nikolaj, I'll hand it over to you now.
Thank you very much, and good morning, good afternoon, good evening, everyone. It's a pleasure to be here with all of you who found time to participate in the call today. And I'm so glad to be here with Steve, whom just 1 year ago we were sitting in Seattle together and doing the handover as I was stepping into the new role. And since then we have been very busy. But hello again, Steve. It's great to see you. How are you?
I'm good, thank you. Nice to see you.
So yeah, when we met a year ago, it was almost another world we were living in, right? So it was pre the pandemic. Global health was important, but since then, boy, it got critical. It got in the news every day. We are talking about the impact of a pandemic like COVID, and obviously, this has impacted our lives, our families, but also our activities and what we do as individuals, but also as an organization. And I will come back to a little bit of what we're doing in Path and how the world has changed for us. But I want to start with you, Steve, because you really used your time very efficiently since you left Path with writing a book, Undercurrents, which came out a couple of months ago. And I would love to hear from you what made you write the book? Why now? What was your inspiration? And also maybe what are some of the key findings from the book that you want to share?
Yeah, well, first of all, thank you, Nikolaj, and thanks for the team at Path. It's really great to be here today with you. I can't tell you how much I've thought about all of you, missed you, been cheering for you on the sidelines, particularly in this very complicated year, and just so grateful that Path and the team and its leadership is moving forward with some, great programs and important projects, and I've been keeping up with all of that. So first, it's just a pleasure to be here, and thank you. Yeah, and it's been a bit of a crazy year for me too. I mean, I kind of imagined when I decided to leave Path, a couple of years ago, that at this point I'd be doing a lot of skiing, maybe a lot of traveling. I was not planning to retire, as everyone knew, and probably I'm not really the retiring type that I think people at Path know as well. But on the other hand, I was thinking of having kind of a different kind of portfolio. But in fact, 2020 has been a crazy year for me as well, as I ended up not only writing this book, which I'll tell you a bit about, but also chairing the World Health Organization's digital advisory group in the middle of this pandemic. In fact, I just got off a phone call with them before this call today, and continued my teaching at Stanford and doing a lot of advising. And now I'm actually overseeing the Gates Foundation's China strategy and China program in this moment. But the book was really an idea that was generated a couple of years ago as I was still at Path, and I was, listening to colleagues around the world and a lot of my students at Stanford and friends and family sound increasingly overwhelmed by the state of the world, increasingly paralyzed by their frustrations with what they were seeing, whether it was sort of some of the policies of the current U.S. administration, or inequities growing in the world, or things not working well that we had hoped would change. And so I started thinking about that and decided that it would be worthwhile to think about what are the, how bad is it? What are the underlying trends that might help us think differently about that? And frankly, how to motivate, is there any opportunity as a longtime activist to motivate people into activism? So I wrote this book, which is called Undercurrents, which describes 5 of these large macro trends that I believe are would help us as activists, as would-be activists, as people already deeply engaged in work, to think of the future, and hopefully will give us courage and momentum and power to continue to make positive social change by following those trends.
Yeah, and some of the things that you highlight as the undercurrents is digital health. And I think I want to start there because a lot of the situation we're in is also due to a lack of information, lack of accurate data, lack of sharing information among countries, among communities. And it has really displayed, in a way, COVID, the lack of coherence, consistency in how we approach sharing and capturing information digitally around the world. So I think the momentum for that undercurrent has really, you could say, accelerated even further. It was going on before, but now I think that has become evident on a global scale that we are lagging behind here. And even in some of the richer countries, my own country, Denmark, in the United States, where I'm now in living, I mean, we see this as well. So I think before we thought that there was a big gap in some developing countries, but we were all under control in in our part of the world, which is really not the case, and not only on digital health. So how difficult has it been, Steve, to make that argument for investments in digital health before the pandemic? And now you mentioned you just jumped off the call, so I'm going to use that opportunity to now. Are you seeing a shift among those that are talking about this at WHO? I mean, I think from our operations, we see this clearly. We are seeing a lot of demand for digital health solutions and making systems work together. And also we're seeing that, for example, our work within malaria, HIV, TB are increasingly, those data systems and platforms are being now retooled, if you want, to also capture data that are relevant for a pandemic like COVID. We're seeing, and I saw this in DRC, our emergency operations centers, who are, again, digital centers managing a pandemic that we helped set up with the government, but now also seeing how those centers can be integrated with other disease areas, infectious diseases in that part of the world. So what are your thoughts on that undercurrent?
Yeah, well, I'd love to hear even more about what PATH is doing and thinking in this area, because it is a super important area. And some people were surprised that I would think of, why is digital a big trend? Isn't this kind of stating the obvious and a kind of an old story? And the reason I framed it in the book as one of these 5 large macro trends or undercurrents that is empowering social activism is because I still believe there's much more to come and ahead of us, that in fact the social sector is still a bit behind, as we saw even in COVID, that we have don't have our act together yet on how do we really deploy and use digital and data, digital capabilities and data platforms to do our work. And so I think most of it's ahead. I also wrote about it because I think there's tended lately to be quite and an appropriate negative reaction to digital and data capabilities. Obviously, misinformation, privacy, data governance are all super tough and critical problems, and we've certainly seen a lot of challenges come up. But my view was net, at the end of the day, you know, this is a very positive and powerful tool for transformation. And I think that COVID has actually put even a brighter spotlight on that. Both the positive and negative, and it has been interesting. In fact, I've written a couple articles that have been published recently about how COVID was really a digital pandemic. Not only, you know, the way that we're all sitting here on Zoom today and teaching our kids through online education, or, you know, attending Thanksgiving dinners virtually, but more that in digital health, we have seen just this rapid transformation in the last year. The volume and intensity of tools. I mean, I'm sitting in the WHO role. I mean, I was sort of at the receiving end of that fire hose, and, you know, it's been amazing. And the collaborations, both, you know, across multiple sectors, get with, you know, traditional competitors in the private sector, you know, is very strong. A lot of tools have been adapted for scale very quickly, which has always been a bit of a problem in the digital space. That there's a lot of cool pilots, but not a lot of scale projects, and yet it became a very critical criteria for a lot of the tools we saw in COVID. So there's a huge and interesting and very robust positive story that I think we need to capture. That said, it also truly exposed the incoherency of our overall architecture in digital health globally. You know, very confusing to what products were available to whom for what use. Is this a vetted idea or a proven idea, or is this just some hacker's dream? You know, who is validating quality? Thankfully, there's organizations like Digital Square, which, you know, PATH has been such a critical you know, supporter and manager of, that have helped some of that. But it's still at a global level. We knew of ministers of health in Africa looking to Twitter to find out what tool they should use for, you know, contact tracing. We still have this sort of demand supply market shaping problem that we've got to solve. And then, of course, the underlying rules of the road around you know, privacy, ethics, data standards, misinformation. Those things we have a long way to go. And then, of course, the access issues that we saw in COVID. A lot of the richer communities get a lot of tools, and the poor communities, not surprisingly, once again, both countries and communities within rich countries not get as much access. So we have a lot of work to do. I think that one of the things I've been arguing is now we have to take sort of that post-World War II mentality where we sort of organized ourselves. And coming out of this pandemic, we need to take that same sort of and focus on policy innovation as much as we focus on product innovation in this space. And I think there's an appetite. To your question, I think there's increasingly more awareness how powerful these tools can be, but also what the dark side is. Obviously, the pandemic has demonstrated misinformation in such a critical way. But there's more and more appetite for bringing networks together, to you know, building more capacity for global health and development, to have more aligned organizations and capabilities. And so I'm positive that quite positive that we'll see quite a bit of activity and momentum over the next few years in this. And I'm sure, knowing the people and the capabilities of PATH, that PATH could have a really big role in all of that.
And we know the staggering number, Steve, that I think now we are over 1.5 million deaths of COVID, and I wonder what would that number look like if we have gotten some of these things right before. As you say, there are there are a supply chain information challenge that goes for PPEs and for just lack of information to the population as well. But then, and I think it's important we mention this as well, is that the digital you could say changes we want to see is also how does those tools actually equip and help community health workers, physicians out in the villages that are spending a lot of time on tying in information on paper. And just imagine, this is also a time where a pandemic where time has really been the limiting factor. We see outworked, exhausted healthcare workers everywhere in the world, and whatever we can do in terms of technology innovation to put in their hands that can make their life easier, have better outcomes, not only with COVID, but also with other disease areas, I think will fundamentally change the sector and how we go about addressing pandemics, but also normal non-communicable diseases, for example. So that's really, I think, critical for us to continue to work in this area. Another dimension that I wanted to also discuss with you is we mentioned the collaboration between private sector, public sector in this space, but I think we have seen it even more successful in the science on vaccines development. This has been remarkable and is something that obviously PATH has been heavily involved with, working with key institutions like CEPI and Gavi to make sure that we will get vaccines on the market, safe, efficacious vaccines, and we are close now. But also making sure that those vaccines and advocate for those are becoming available for the entire world in an equitable way. So that is something we have been working a lot with our partners in this year. But I think that what we have seen this year in terms of private-public partnerships is also going to, change as much as digital health, the way we go about innovation. PATH was already there because we have been working with private sector for more than 40 years, but I think other players have been slower to adapt. And if you look at, the Sustainable Development Goals, the 2030 Agenda, the private sector, there is an ambition that energy, that innovative capability is put forward. And it has been, I think, as we look beyond this will be one of the changing dynamics of the work we do, the integration and ability to do partnerships with private sector.
I just on that, Nikolaj, I agree that multi-sector collaboration. I mean, I've been talking about it for most of my career and certainly in my academic work, but is just so critical now more than ever. And I think we see more opportunity, both in terms of, and certainly something a global crisis like a pandemic has accelerated that. But and I completely agree that PATH has been an incredible leader in that space and remains that, and that'll be important. One of the other trends I talk about in my book, among the 5, is the first one I talk about is this idea that the world is actually not only generally getting better, contrary to the headlines, the trend lines are generally quite good about over a period of decades, mortality rates are going down, girls' education is going up. Most trends, not all, but most trends are going in the right direction. So we have to be thoughtful about keeping that momentum is really critical. And part of that is the world has shifted demographically, what I call, the pyramid to diamond effect, which is the idea that that we've been actually thinking about the world a lot as a pyramid for quite a while. We talk about the bottom of the pyramid with rich countries and rich people, whether whether the metric is income or wealth, is sitting on the top with a very few, and then large groups. The most of the world is at this very fat bottom of the pyramid, which is people living in poverty globally. The fact is that's changed dramatically in the last decade or two. We no longer actually have a pyramid, but it's become this sort of funny shaped diamond. Still the majority are in the bottom part, but it's kind of a fat diamond at the bottom. But the point is we have, of course, extreme wealth at the very top. So at the top is this narrow little spike at the top of the diamond of, the amount of wealth the top 100 families have in this world is just staggering, and that's only gotten more exaggerated in the last 6 months. But at the bottom, where people don't pay enough attention, we're also seeing fewer people at the very bottom, and more people moving into the middle class. And the middle class is now defined in different ways, is now bigger than it's ever been in the history of the world. And we still see tens of thousands of people moving from abject poverty into the middle class every day. Now, I agree that's a global standard, and in this country that group has suffered greatly, but we don't have the level of acute abject $1.50 a day poverty that I'm talking about. But so why is that important? Well, first of all, it means we continuously need to think about helping communities within countries, not just poor countries. So the whole global health and development architecture is built around sort of what's a poor country. Let's go give support to poor countries. The world is changing, that we have to rethink, as we've seen in Gavi and others, that what about middle income countries who still have some of the poorest communities in the world, like India? So those are things we're going to have to do. But the other and probably more important piece of this is it provides more and more incentive for private sector engagement and development. And that's a good thing, that we see, because more people are now low middle income consumers. Business solutions can actually be part of that progress to move people into either better well-being. And so I think that we haven't thought enough about the implications about the pyramid to diamond, but I do agree that will mean that more and more private sector collaboration in global health is ahead of us.
And now we will see how that diamond unfolds, right, Steve? Because we have seen now, and unfortunately, that the level of people who goes back into deep poverty is increasing, according to many sources, and people are losing their job. The World Bank estimates more than 100 million are back. Obviously, healthcare expenses growing. So it's going to change, but I mean, the overall trend, I think, as you write in your book, is evident, and it will also mean that other diseases are going to be diabetes, cancer, and other are going to be more in focus. But I want to stay a bit on the on these implications of and the impact on people's life, and what you call it, maybe the bottom of the pyramid, because we know that as a result of the pandemic, we have lost, some say, a decade of progress in other areas. We have seen immunization are reported to be disrupted by at least 60% of children. So this is really also impacting our children in terms of the vaccines they're getting, their chances of getting sick, their chances of live beyond 5 years old. And also, if you look on the education aspects of it, again, an important dimension in equity. So I think those effects and how they are shaping and how long they will last is really instrumental. And I'm wondering how we're going to recover from that loss. It is a loss that we have seen this year. There's going to be, and we are advocating for that heavily, and also doing what we can to restore basic services. Again, rebuilding primary healthcare, or starting to focus on that, so that we quickly can catch up on those populations. But it's also, I think the economic effects and the social determinants of health have not changed, right? It is the people that have poor living conditions, no access to water, sanitation, and that are also hit the hardest by this pandemic. And I want us, and I think your activism, Steve, and I want to speak a bit to that. How can we create that, momentum for more activism, as you also write in the book, to actually make sure that the world doesn't forget those issues that will be even more evident and maybe even more long-lasting than the pandemic?
Yeah, well, Nikolaj, that's a huge question and really a tough one. But yeah, no, I don't want, now, while I think there's some potential learnings and new possibilities that have been exposed in this crisis, I don't want to at all underestimate the tragedy and the damage and the grief that so many people around the world are experiencing, whether directly because of being frontline workers and working directly, just these horrendous conditions, or people who have family members that have, or friends that have been sick or died. And certainly the economic, and humanitarian follow-on crises are staggering. And I'm spending a huge amount of my time, with folks working on what does that look like moving forward. It's when I'm at the Gates Foundation in a just kind of looking at what's happening in China, where they're already moving into the sort of post-COVID phase of their development, because they've suppressed the virus so well, and what are learnings from that? What do we do about global debt relief? What do we do about a bunch of things that need to be addressed? But I do think that, a couple observations. I'm an optimist, as you know, and that's clear in the book. But I'm a realist, and I do think that a lot of the fundamental structural things that I talk about in the book are not going to go away. That they're going to still continue to drive some of these trends, despite the enormous setback that the pandemic has created. I do think needs to be a whole lot of focusing back on the very, COVID is a bit like the 5-year-old soccer game where everybody's been tracing the ball and forgetting their position on the field once in a while. And I think we have that problem right now, where we're going to have to recalibrate and remember that we've still got a lot of other diseases and a lot of other human conditions that we need to spend more time focusing on. And then I'd say that, that we also have to be super, more conscious than ever. And this is, again, it's actually another trend I talk about in the book, to focus on equity as just a core value in activism more than it ever, and it's always been there, right? People have been fighting for places at the table. I've been a long time civil rights person and did a lot of human rights work in my life as a gay man. But so fighting for a place at the table isn't a new phenomena, but I have to say that the opportunity in the social sector and coming out of COVID, it's exposed so many. I see, someone's comment in the chat. It's continued to expose so many deficits in the way that certain communities, certain Black and brown Americans, or poor communities in certain areas of the world are not getting the treatment, are not getting access. First and foremost will be the way we handle the vaccine distribution. The data is just overwhelming, as you know, that if we do a good job vaccinating most of the world, instead of most of some of the world, instead of, that we will actually suppress the virus and get over this pandemic faster. That again, if we, don't, instead of we're going to do all of some countries, rather some of all countries, is going to be a mistake. Now we're already heading down that path because of vaccine nationalism. Hopefully we'll have enough vaccines to get to people who need them in all parts of the world. But that path is challenging, and we're going to have to work very hard to keep that momentum, because otherwise it just further divides the world in which between the rich and the poor.
Yeah, I'm changing locations. Can you hear me still, Steve?
I can hear you.
My computer just, we talked about digital, my computer just broke down. So I just switch device and room here. So no, I think it's great that you bring this up, the vaccine distribution and equitable distribution for that. It's beyond important. And I think for the first time, and we saw this from G20 and country and national prime ministers are committing to COVAX on an unprecedented scale. So I think in the G20 final statement, there was a mentioning of health equity, and I don't think I've ever seen anything like that in an official document. So this has become part of the vocabulary that we now use together. So I think that momentum and that understanding of equity is now more present in people's mind than ever. But I think it doesn't stop with preventing vaccine nationalism. It has to also go in the borders and in the countries where those vaccines are going to be distributed, because there will also be a discussion of who gets that vaccine first in the countries, as you mentioned. And as we also know that there are minorities, there are tribes, there are governments who are and countries that are run by minorities, and how does that distribution happen inside that country so that everyone get a fair access to vaccine according to the criteria defined. And I think when we talked about activism, Stephen, in your book, so that activism need only to continue as well. And that's why our work in the countries, understanding the needs in each and every country that PATH operates in, and the countries where our other NGO colleagues work in, are going to be critical to held leaders accountable for not only getting the vaccines to the populations, but also making sure that it's distributed in a fair manner and with the right resources allocated to that. So I think that's key.
I mean, one thing, Nikolaj, I'd love to hear, and I know we'll get some questions now, but is, I mean, PATH has been on a 40-year journey, and certainly in the last few years, particularly focusing on, how do we pursue the equity mission even more consciously, more effectively, more inclusively, so it means within our own walls as well as within the world we're working in. And it gets into a wide range of work that, folks when I was there were leading, and I know you've been doing a lot to continue supporting, efforts around, creating, more voice of our country offices and regions, DEI activities, work on decolonization. I'm curious just how that journey's going at PATH. I think it's a really important piece of this story, and it was certainly part of my thinking in the book. But I'd love to hear just how that's gone this year from your perspective. I don't want to put you on the spot, but or a few things that you might have done that you're particularly excited about.
Yeah, thanks, Steve. And I think also COVID has again taught us the lesson that, I mean, health challenges are solved and addressed in countries and communities where the issues are facing the population. And we have seen this with COVID as well. Every country, and I've been in 6 of them during the COVID time, is handling this differently. they are addressing issues of supply chain, communication, access differently. So what we saw early on was that there was a need also to make those decisions, those calls in the countries and by our country leaders to really address what their countries was facing. So in a way that accelerated the need for also addressing some of the issues that we have in global health, which is that there are a lot of positions in leadership, there are a lot of power gathered in the global north, and with what we are seeing in terms of the challenges we're trying to face, and this was simply not the right way to organize ourselves and the right way to implement, to design projects. So what we started was, I would say, a significant change where we have created more leadership positions in the regions. We have also addressed decision-making lines of, so very, very practical things that who makes the decisions, who has the resources, where are the budgets allocated, all of these things, enabling our leaders to really work with national governments, communities where they are, to make decisions on projects that can help locally. So that has been some of the changes we have done this year, and I think this is going to continue also beyond our sector. I think another important trend is that it has now, and I heard this clearly from ministers of health, that the vertical approach that has been used for so many years needs to have we need to have a relook at that. So not siloed funding and in malaria, HIV, TB, and so on, but more integrated funding. And I think that's going to be a change also, which speaks to the need to really understand what are the challenges that a country is facing, and how can we help build that primary healthcare, that ambition for universal health coverage. How can that be built by integrating those vertical programs that are critical, but how can PATH as a leader in global health with so many expertise areas within health, but also solutions, help those governments to really address this in a holistic manner? Because budgets are always going to be stressed. So there are always going to be a lack of funding, and the priorities needs to be made. So if we can play a role by helping with technical assistance to provide some perspectives, I think we're doing a better job, and we need to do that starting in the countries. And that has been one of the key assumptions for the change that we have made this year.
Great. Well, that sounds terrific, and I hope that it sounds great set of ideas and decisions. So as always, I'm rooting for all of you, and I know that will make a big impact. Looks like they're suggesting some questions from the floor we should take.
Yes.
All right. Thank you so much, Steve and Nikolaj. So again, this is Caitlin Jolie with PATH, and I'm just going to pose a few of the questions we've received from our audience. And Steve, it looks like the first one is for you. So what can and should we all be doing collectively and individually to create social change? I think this person is looking for some specific examples, any practical advice you have to share there.
Yeah, it's hard in any given context to answer, but it is sort of the sort of a core theme of the book, and it's in the title, is it's how to channel outrage, which I think a lot of us are feeling about a lot of things, to spark practical activism. And my view is activism sometimes has had sort of this sort of either very refined view or sort of negative view sometimes, like corporate shareholder activism or street activism, versus, you know, the fact that all of us have an ability, if we care about the world and our families and communities, that we have the ability throughout our life to find ways to use our skills practically and then go and work toward making social change. So I try to give examples of ways different people have done that, and why looking at these 5 trends helps that. And it really ranges, you know, it's hard to be terribly prescriptive, but often it's just saying, what am I good at? And you know, if I'm good at accounting, then maybe going find a way to help a nonprofit in your community to work on, you know, their finances. Or if I'm good at, if I really enjoy teaching or training, you know, there's lots of opportunity right now to volunteer for, you know, because there's this need in the gap in our community about people who need to give online, parents who are trying to teach their kids online a break and have more organized ways to do that. And so I think just looking around, I always tell people, start with your neighborhood, right? Your neighborhood probably has some issue that's bugging you or your neighbor or a friend that has an idea. And most social change in the world actually did not start through big ideas coming out of Geneva or Davos, but they came out of kitchen tables in sitting in neighborhoods. And so be very practical. I think we've gotten a little bit carried away, and I've written about this, with the big philanthropists or the big ideas or the social entrepreneurs with their clever, and it's almost intimidated people, like, oh, I'm not smart enough, I'm not creative enough, I don't have enough money to go make a big splash. And you know, I think we have to be careful. While I'm glad people are doing all of that, you know, the reality is practical activism is, you know, can be done in very small steps, and can be done by people that have no money or resources, but can be, you know, rolling up your sleeves. So I'd look around your neighborhood, volunteer for a nonprofit, you know, be willing, obviously, if you have resources, to give them, you know, you know, right now we need to look around and think about our neighbors. There are a lot of neighbors hurting, no matter what community we live in, and I think that's a place to start.
Thank you, Steve. That's a great reminder. Nikolaj, we have a question about PATH. So what does success in 2021 look like at PATH in the wake of COVID?
That's an excellent question, and could be a very long answer as well. I think if we have in any way contributed to ending the pandemic by providing access to vaccines around the world, I think then we have really contributed to something. We are, as I mentioned, also working with key partners in the response, and also looking at how we can help manufacturers scale up, how we can help developers of new vaccines to actually pre-qualify for WHO approval. So if PATH has in any way contributed, and I know we will, to ending the pandemic, and not only in the United States, but also around the world, then I think we have been successful. But that's not the only one, obviously. Another aspect is how, and I spoke to this, how can we quickly restore some of the essential services for children, for families, for everyone around the world that they have been missing. People can go to cancer screenings again, being treated for diabetes. How can we restore this and also get the immunizations?
Did we lose him?
Sorry, it looks like we might have lost Nikolaj's audio. So we'll give him a minute to jump back with us. But Steve, we've got some more questions for you. So the trends that you identify are framed up globally. Do these trends also apply in the US as well, or to higher income countries?
Yeah, no, I struggled a bit in the book. I mean, there are a lot of things I struggled with in the book, and of course, it's like one of those things now that if I only could do it again, this is what I would say. But I did take a global view, and I frankly have always taken a global view. I'm sort of God forbid, I am a globalist, and think of my role as a global citizen probably first and foremost. But in fact, almost all these trends have a U.S. component and domestic component. Now, one could argue the first issue of how well the middle class is faring is a bit different if you look at it more domestically, and there's data to support that. But some of the underlying pieces of that, which are more engaged, focusing more even in a rich country like ours on the more vulnerable communities in more intentional ways of blending private and public sector solutions, are all still relevant. And certainly, issues around equity, issues around technology, issues around scaling all have, and issues around community voice all have relevance in the domestic context.
Great, thank you. And another question that just came in for you, Steve. What's your opinion about emerging information that China's COVID-19 vaccine may make it to some African countries first, far ahead of other successful vaccine candidates we already know of and that have been widely publicized? So what's your opinion about that?
Yeah, well, I'm not sure opinion is probably the way to frame it. I certainly am spending my night and days on this issue right now, which is, so just to clarify, I've been asked by Bill Gates and Mark Sussman to be interim director of the Gates Foundation's China program and strategy as they go through a transition. It's a part-time gig alongside of everything else I'm doing. But obviously, the role of China in COVID looms large, but politically for all sorts of reasons. Its own ability to suppress the transmission has been, kind of a model for many people in the world, despite it being very driven by they had a political structure in which to do that. But they also have, a lot of tools, therapeutics, diagnostics, and vaccines. So we're watching closely how this evolves. I mean, my bottom line, personal view is that, if they're safe and effective vaccines, that, the world needs as many of them as they can to get distributed as fast as possible. The operative line there is what constitutes safe and effective. So what we're trying to do at the foundation is to work with with those manufacturers, whether they be the CEPI sponsored ones like Clover or the others like Sinopharm and Sinovac and others, to ensure that we get more access to their data, that we understand better, that we, the global community, gets and people, the countries that are receiving them, get better access to data, better understanding of the clinical review, hopefully WHO or stringent regulatory review and approval. The reality is China, operates, partly within the global community on these issues, but also does, they've given emergency use authorization to their vaccines. They have no, goal of giving unsafe vaccines to their population, and they've, already vaccinated probably over 1 million Chinese with the two leading candidates there that haven't, and we're seeing their distribution around all of the world, Africa included. And, so we need to get smarter on what that looks like. But I think we need to plan or imagine in the 2021, 2022 period, where we're going to go through this most, remarkable and complicated mass vaccine effort that the world's ever seen, that Chinese vaccines will end up being a very big part of that solution, at least for parts of the world. And we need to understand what that means for our own models. We need to hope that, there's more data and understanding of those deals. But I also think that the reality is given the COVAX facilities constraints, that still not, and they're probably not going to be able to give the time frame for the COVAX facilities, actually, and even the mRNA vaccines themselves, the cold chain challenges of those, that having these other vaccines that are less susceptible to cold chain problems, more quickly available, might be part of the solution Africa chooses to find.
That's great. Thank you so much. And Nikolaj, before you jumped off, you were mentioning immunizations. And so we have a question for you about PATH's role in the COVID-19 vaccine distribution over the next year. What might that look like? And can you share a little bit about PATH's role in the COVID-19 vaccine distribution plan?
Yeah, so I just want to also maybe recap what I said. I don't know where I jumped off before, but before I just do that, I just on Steve's question on China, it is just a fact that a lot of the capacity to manufacture vaccines are in India and China. And there is a lack of capacity right now, as some of our studies have shown. So I think it's all hands on deck everywhere around the world where there is ability to produce as well. So I think that's China is a global health player, and the world needs vaccines and manufacturing of those. So it's a fact. So what I said before in terms of success for PATH, I said before I jumped off, I think I mentioned that being able to contribute to a vaccine on the market, being able to help getting that vaccine out in the communities where they need it, but also help restore essential services, other services, immunization, as I mentioned, and then advocate for change as well. We talked about activism, but advocate for investment in pandemic preparedness, advocating for investments in national health systems. All of these things are going to be critical. And if we can do that and be part of that change, then we will have make an impression in 2021. And that's what we want. We want global impact in health. So, and including on distribution. So the question is that how can we help? Right now, as probably many of you know, that Gavi, we talked about COVAX, is the main responsible for getting vaccines out, and there are players in that ecosystem for other vaccines like UNICEF, WHO, who are the main players in distribution, and we are advising those organizations and helping and supporting them to make sure that those distributions are happening. So we are partners with Gavi, partners with UNICEF, with WHO, and are playing our part in making sure that that vaccine distribution happens. But those are the main organizations who will be doing the actual distribution work. I think what we will contribute with is more in terms of supporting on and bringing up health equity issues, looking at the capacity of manufacturers, looking at countries, what are the needs. Digital, we talked about that. How can we actually use our digital health capabilities, which we already use for other immunization programs? How can we put that skill to use for also COVID-19 distribution? So I think we have a lot to contribute with in terms of what we have done in normal immunization programs, and we want to also make sure that that is being used for COVID-19. So we will be part of that.
That's great. Thank you, Nikolaj. I know we just have a few minutes left, and so we wanted to just wrap up with maybe a final question to each of you. Can you share about what you're optimistic for when you look ahead to 2021? What gets you excited, and what do you think is a cause for optimism for next year? Steve, can we start with you?
Sure, and let me just first of all say I see Conrad has asked some really great questions, and it's wonderful that you're on the phone and with us today, Conrad. And I'd love to reconnect with you, but also I feel like, you're a good example of what practical activism looks like in a community, really taking what you know and helping others and building community and network. So I should have written a whole chapter about you, but thank you for engaging. So I'm optimistic, sort of by nature, or reasonably risk averse by, not risk averse by nature as well. And so I look at this, first of all, I think we'll just all be glad to turn the calendar on January 1st. That's like enough already, done with 2020. Secondly, and that'll probably be a boost in and of itself. Secondly, I think that having a new administration in the United States gives us some opportunity to get some other, to focus on some new things, or rebuild some old alliances. And so I think that will help. It won't solve all the problems, and some of the underlying issues had nothing to do with the administration. So we've got a lot of work to do, but that gives me optimism. And finally, I have to say, as devastating and as discouraging as this year's been around the pandemic and the economic challenges, as always, kind of leadership matters. And so we've seen that certainly on the negative side, but where I see it on the positive side is so many incredible people raising their hand all around the world. And, this is, and fortunately, many of them a lot younger than me, and most of them don't look at all like me in terms of their gender or race. And I just think that's very powerful. And it gives me a lot of optimism that the world will keep moving forward despite our challenges, with next generations of leadership that are more inclusive, more diverse, and also bring smarter and better ideas to the table. So to me, I'm super happy about that.
Yeah, on that note, I think we have reasons for optimism as well. I mean, science is now providing a path forward for the world, that we have vaccines coming out in record speed and with collaboration on an unprecedented scale. So I think science has really proven to be a solution for all of us here. And I think that is important, as we have many other needs in terms of new vaccines that needs to be developed. So there is now this momentum and acceptance. There is obviously hesitancy on taking vaccines that we need to address, but I think science makes me optimistic. It also makes me optimistic that WHO and the US government has said they are going to come back to the table. I think we need a global response. We need the United States to be a player. They are potentially joining COVAX as well, which they're not part of today. And I was participating in a call with people from Congress and Senate, and it seems like that there is a consensus on the need to invest in global health security also, even more than before. So I think the US is ready to also address pandemic preparedness, investing in systems. And I think that's going to benefit so many people around the world if we not only look at responding to a pandemic, but also making sure those immunizations happen, that we are getting those labs in place, that we are investing in frontline health workers, so that the people who need to have healthcare will also have access and can afford it, and grow as individuals. And I think that makes me optimistic that there is a consensus on these things that I don't think that there has been that before. So we need to make it happen. And we will play a part in that, but it gives me reasons for optimism.
Well, those are really hopeful notes to end on. I want to thank both Steve and Nikolaj for your time and sharing your insights with our attendees today. And thank you to all of our attendees who did join. This call was recorded. It will be posted on PATH's website later today or early tomorrow. So be on the lookout for that. And just thanks for your continued partnership with PATH. Have a great day, everyone.
Bye-bye.